All right, all right, all right. I believe we are live and streaming. I see it's still circling, but hopefully there we go. We're live. It's good to see you all today. Um, I'm just having a good day. I hope you all have been having a good day as well. Little sad though today because I have two of my supervisees who will not be with us anymore. I'm losing two, and they've been very special on my Friday group. They engage a lot. One of them, we have been meeting for almost 3 years because there was a little bit of a lapse in between the time that she started and then had to stop and got back started. So you develop some close relationships, and it's a bittersweet moment when they leave. And so that's been kind of tough. We just finished that group just now. But I've got some stuff to share with you all, hopefully, that will help you if you are a supervisor. If you are not a supervisor, I think this information will help as well. We got a couple of things that we are going to be going through today. If I can find my screen, here we go. All right. And so we're going to be starting off, we're going to talk about a couple things, but starting off with the question, what medications are being used for manic episodes, right? That's what we're going to cover, but we're also going to cover a couple test questions because I like to cover test questions when I'm working with supervisees. This keeps them tight and ready for the exam, but it also it gives them the opportunity to learn how to function well in practice, know the right decisions to make. And so we have a really tough ethical question that we want to ask and find out about as well. And then we're going to do the medication. So we've got quite a few things to cover. Let's start off. Let me see with this first one here, and I'm going to see if I can share my screen so you can see this question. Let me get it to where you can't see the answer. And we're going to go through this really, really fast. So, again, in supervision, many times we're talking about theory and how to bring theory into practice. Okay. And so, one of the questions here, we may go through some Maslow and things like that, but let's just go on and get into it. Which of the following, I want you to be thinking if you know the answer to this, which of the following best describes or best represents the correct order for Maslow's hierarchy of needs? Um, Psychotherapy, I'm sorry, hierarchy of needs, starting from the base of the pyramid. So we're working from the bottom going up. Okay. What's at the top of the pyramid? What's at the bottom? We're starting from the bottom going up. And so I want you to think about what the answer is to that question. You can look at the options here, see what the answer is to that question. You can put it on pause or something, but I am going to go on forward and give you the answer. And the answer for this, oh, I should have make sure I have my notes here, but let me look at it. Physiological safety, loving, but it's C. It's C. All right. The answer for this one is C. And the reason, one of the ways, and we'll a lot of times in the group go through points like, okay, do asking the question in order for you to get to the next level, do you have to complete the level before, and how does that work with Maslow? Also, ask the question. I had a multiple choice that I asked some of the other groups is before I even got to this one is who was responsible for the development or was a leader and a force in the humanistic behavioral type of thing or humanistic I'm forgetting the term that I'm looking at, but basically Maslow was a big part of the humanistic movement as it relates to psychology and these things. So we had a multiple choice question for that. But the answer for this one again is C. Now I like to use mnemonics. Okay, so for many of my supervisees who think like me, a lot of them are really bright, and so they don't have to use mnemonics. But if you think like me and you just don't get it right off, I like to use mnemonics. And here is one I want to give credit to Quenisha. I actually, she's a former supervisee who I need to talk with, by the way. Um, who I was giving another mnemonic that was very similar, but it didn't hit as well. And she was like, "Well, why don't they just do it like this?" And so I've been using this one ever since. And P is for physiological needs. S is for safety, of course. Love and belongingness. Okay, it says love and belonging on here, but love and belongingness. And then your your was it your esteem is what this one is for, and then from there, this is at the top of the pyramid, self, which is self actualization, and we talk about what that means. How do we make it to the top? Who are people who are at the top? Things of that nature. Okay, let's keep it moving. I'm talking too much. Let's go, let's go, let's go. All right, so I have another question for you. Oh, and we also discuss, what physiological needs are and things like that. And so, but we're going to skip past that to the next question. So, a clinician is treating a patient with bipolar disorder who continues to experience manic symptoms despite being prescribed lithium. Which of the following medications is most likely to be added to stabilize the client's mood? Okay. Okay, so we have a clinician that's treating someone who has bipolar disorder, and they continue to have manic symptoms despite being prescribed lithium. Your supervisees, and we should know that one of the first lines of defense for someone who has bipolar disorder is lithium. What does lithium treat? Okay, so we talk about that. What does lithium treat? Lithium treats what? Manic symptoms. Okay, and what? Okay, so it treats manic symptoms. So if we have lithium treating manic symptoms in this situation, let's just say that it wasn't working well. Which of the medications would might commonly be used in addition to stabilize the client's mood? And that's a big thing. Stabilize the client's mood. The way that medications works, sometimes a lot of these could probably be used and be considered stabilizers, but we're looking for one thing in particular, and the answer to this one is actually B, Depakote. Also, the name, the brand, I think, is Depakote. The other name is valproic acid. Okay. And so what we'll do normally is go through each of these. We know Ritalin is for ADHD and some other things. Ritalin is also, let me just stick with the script. Fluoxetine Prozac is used as an antidepressant. I think Ritalin is also used for focus, but don't quote me on that. I'm a little blurred right now. And then Haldol, we know, is used for as an antipsychotic medication, which is sometimes mood stabilizing. I know when I was working in a nursing home, it was also used to treat behaviors for individuals who weren't experiencing positive symptoms or psychosis. Haldol can be used and sometimes maybe also used for bipolar, from what I'm understanding. But the answer to this one is Depakote. Now, this is really interesting because Depakote is considered what? Is Depakote, if you were to identify what type of classification Depakote would fall under, it's used for a number of different things, which is really interesting. And so Depakote is used to stabilize moods, but what we notice is there's some kind of a phenomenon to somebody like me, because I'm not a scientist or real deep into the medications, and I don't prescribe medications. But what we notice is that um, there are medications that are seizure medications that are often used to treat and stabilize mood. Okay. And so that's something to keep in mind. What are a few mood stabilizing medications that you know of that might treat mania or depression? Okay. Manic is we're having excitable symptoms. We're having elevated symptoms, grandiose thoughts, those types of things. And usually with manic symptoms, in order, if someone has bipolar disorder, I'm going off the script, if they have bipolar disorder, they would have to have manic symptoms existing at least for how long? 1 week. Okay. All right. So there are some medications that are used to stabilize the mood, just like Depakote is used, just like lithium might be used, but these are anti-seizure medications that are being used actually to stabilize mood. And so we talked a little bit about that, and let's see if we can see the list of those. So these are common anticonvulsants, uh, which are anticonvulsants are usually medications used for seizures. And so we have Depakote, Tegretol, and Lamictal. Okay, and so Depakote again, many times will treat mania, acute mania. Okay, it's often used when lithium is not as effective, or is not being tolerated correctly, or sometimes it may even be used in addition to lithium, okay, as a combo to kind of level things off, or in an exchange. And so then we have Tegretol. It says sometimes it's used as a second line treatment, okay. And then we have Lamictal, which Lamictal I think is mainly going to a lot of times treat it may treat some of the depressive symptoms, but is more effective for bipolar depression, yes, than acute mania. Okay. And so we talk about the differences. These can end up on the clinical exam. Okay. But it's also good to know if you're in practice and treating. Now, we want to move on. Where are we at? 38, 40. Okay. We're not doing too bad. So, I had a test, well, not a test question, but a scenario here. Um, and this was interesting. So, uh, we wanted to get some perspective, because we want to make sure that we're being ethical in practice. And I always talk about how easy it is many times to cross ethics, not knowing. So, if you're a supervisor, you want to constantly bring ethics into the equation for how you are running your sessions for supervision to make sure your supervisee's license isn't compromised because of a crossing or a violation of ethics, but then also protect your license, but also number one, to protect the safety of the individual that you are serving. All right. Or that they are serving. So here is a scenario. Um, and so we're going to read it. So you receive a phone call from a man named Jay who says he was referred by his spouse to start individual psychotherapy. Jay shares that he is currently incarcerated in Alabama, but wants to begin telehealth services as a condition to uh, eventually reuniting with his spouse for couples counseling. He explains uh, that he has access to a personal cell phone. He also offers to pay for the session using Cash App. Jay is articulate and sounds highly motivated to work on his marriage. He expresses urgency in starting treatment soon and asks for weekly sessions. So the question is, how should the social worker proceed? Okay. So now we know that we're living in a day now where I've had loved ones who have reached out, through social media, reached out through cell phones. They're allowing for the use of devices in the prison system. Okay. So they may have tablets for personal use for certain things. Um, and so, keeping that in mind, if you have someone calling and they're actually wanting some support and seeming like they're reasonably of reasonable mind, not up to anything, just trying to get some help to repair their mind and thinking, getting themselves ready for to get back into um, you know the regular citizen life after their release. How do you help them? So this is a great question. How would you help them if you were um, given a call and you had your own private practice or was working at a private practice and you received this call? What would you do? This is a good thing also to train those individuals who are taking in the calls and booking appointments, because many times they're not therapists, so they may not be aware of certain rules and ethics and things of that nature. Okay. So, what would you do? What would you do to help? How can we support Jay? Okay. And so we're going to move forward. How could we support Jay? Well, there there's a couple things going on that we might need to know about. Um, Anytime you have a client or potential client who is in custody, that means that in this situation, they don't have rights over themselves in the same capacity that they did when they were free. They can't just do whatever they want to without authorization and rules and protocols. And so there are protocols. We may not know of them, but there are protocols that need to be followed when dealing or working with incarcerated individuals, right? And so we have to ask certain questions, okay? And one of the things that we should know is that it would always be necessary if you are talking to someone and they acknowledge to you that they're incarcerated, they gave you a call, they want to receive telehealth services, you would need to make it clear that, hey, you know what? Well, there's some questions. Let me just stick with the script. So, here's some of the order of things. Keeping in mind that there is a system, they don't have the same rights. That means that we need to connect outside of this individual so that we don't get into trouble. So, what's one of the first things to know? This is really important to know that in most prison scenarios, in almost all prison scenarios, a cell phone is considered contraband. Okay. A cell phone is illegal and it's considered contraband. We had a supervisee speak about how um, this is really unfortunate for the individual, but the individual thought that they were going to be using a cell phone to expose the prison, okay, and some inequities that they felt were occurring in the prison system. Well, guess what happened to them? And this doesn't normally happen, though, to be honest, not from what I understand. But they got 10 years for each cell phone. That's like murder, a murder sentence. People murder folks and get out quicker than that. Okay. So I think they wanted to make an example of them or maintain an example of what they're saying. Hey, look, don't even think about it. If you anyway, we'll stay on script here. So it's considered contraband and may violate the institutional rules and even criminal statutes. So, what should you do? So, this is really important. If you were to come across a case like this, what should you do? You want to verify legality with the facility. You cannot move forward without first verifying. We got to wrap this up. First, verifying with the facility, um, to make sure that this is all right. They may have devices, but those devices are tracked and there's certain conditions and rules for them to even use them. And the prison needs to know exactly what's going on. So don't assume that it's just allowed. You want to contact the facility directly. But this is the thing. When you there's certain places that may have different rules. So if the individual's in a halfway house or reentry program where there's or electronic monitoring is what they're using in the situation, a cell phone, it could possibly be legal. So we want to ask questions, but again, you don't want to just receive all your information from the inmate. You can ask some introductory questions from them, but then you want to verify from someone who is in authority. And to be honest, I probably just wouldn't mess with it at all. Unless I already have a contract and something established where I know that the prison is allowing this. Okay, so that's one thing, all right. And then so we want to clarify their custody status because just because they're incarcerated doesn't mean that it's is what we think it is. So you might want to ask them directly if you feel that it's needed. Are you in a correctional facility? Are you on work release or in a transitional program or under home confinement? What jurisdiction or agency are you under? But then you want to protect yourself clinically and legally. So you don't want to start therapy unless you know for sure what you're doing and that this is allowed. Again, cash apps, if you're going to take money from a cash app, um, what other transactions are going on that cash app? And now you are attached to this particular situation. All right. So those are some things. And this might be a thing that you want to do. So if someone's incarcerated and contacting you on a cell phone, your professional response should probably be something like this: before we proceed, I need to clarify your custody and status, and whether this form of communication is approved by the facility or supervision agency. I want to ensure everything is legal and ethical on both our ends. Okay. And so, no, we don't need a sample. Uh, we don't need a sample of this. But so these are some things to keep in mind when you are if you were to ever have this situation. Sometimes I share things that have actually occurred. Uh, and sometimes I'm just sharing, you know. But we want to make sure that we're ethical and in line so that we can maintain our license. We don't get into any situations where that we end up getting ourselves into trouble or putting someone else at risk who we choose or deem that we want to care for. I'm going to go on and end it here. There is one thing I do want to say before we end here. I did, and I always forget, y'all. I mean, because I'm just ready to get into the content. So we have a CEU coming up that's free for social workers of Alabama. There's a small fee for those who are outside of social workers of Alabama, and we're excited. It's called Understanding Invisible Wounds: Focus on Traumatic Grief. So this will be on June 17th, and we are happy to and excited to have speaking for us Reverend Nikki Arnold Swindle. Nikki is speaking for us on this, and we're so excited to have Nikki. She has spoken for us before, and she's very knowledgeable and very, good. She's very entertaining. I love listening to when Nikki provides presentations. And then we have the DSM-5 TR for those who are LICSWs and looking to get those required 3 hours for your DSM training. Come see us. We have the links attached, or we'll have the link attached on our page. Um, and then also, we have a social work supervisor training. Now, this is an awesome way to increase your income and increase your reach and ability to help others. There's no finer reward than this, or this is one of those that's at the top. We do have a supervisor training coming up on the 28th and the 29th of July. So stay tuned and let us know if you have any questions. If you have any questions about this, put it in the chat. Looking forward to talking with you on next week. Y'all take care and have a good one now. Bye bye.